All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. In each episode of this talk show, we try to bring before you an expert doctor from Al Hilal Hospital to address your various health related queries and concerns. Today we would be discussing about dementia. Dementia is a condition that affects the memory, thinking and the ability to perform the daily activities of a person. And to speak authentically about this subject, we have with us Dr. Roopchand from Al Hilal Hospital, Muharraq. He is a specialist neurologist, and let's move on to the doctor and know more about this condition. So, doctor, welcome to the show and thank you for joining us today.
Thank you.
So, doctor, most of our viewers would like to know more about dementia. So, how do you define dementia?
Dementia is any condition that affects our cognition to a level that that person is not able to perform the activities of daily living. So cognition, I know it's a complex term. Usually we know that dementias affect our memory. Memory is just one form of cognition. There are other forms of cognitive abilities that we humans have. So let's start from memory itself. Memory is the ability to store and retrieve information at will. So like we are talking right now. So I will have a memory of this and I can recollect this at a later part of my time at my will. This is memory. Like that, another thing is called attention, which is the ability to have sustained focus on a single thing. Another one is problem solving skill. We have a problem, so we should be able to thought about it and able to solve it. Another skill is our language skill, in which we are able to produce sounds or write with lyrics and communicate to our social environment, formulate ideas. Another one is executive function. Like I have to go out of this room, so I have to get up, I have to climb down the stairs, go out. So in order to that, I have to have an immediate planning. How to do all these things. So these are the few of the complex cognitive abilities that we have. So dementia affect not only memory, all these abilities, and it will cause an impairment of activities of daily living on a person.
Okay. So now you gave us an idea about dementia.
Yes.
So doctor, around what age this condition occurs?
Generally, dementia is a disease of the old age. Usually it happens in persons above 70 years of age. But again, there are some forms of dementia which can occur in younger persons. Example, there is a disease called Huntington's disease. This is a genetic disorder in which the young person can have dementia-like presentation. Also, certain kinds of metabolic disorders, like in simple terms, like a thyroid disorder, which causes a low level of hormone in the body, and we are not treating this. This can present like a dementia, or certain liver conditions. This can present like dementia in young person, but generally, this is a disease of the elderly.
So now, doctor, can you explain about the different types of dementia?
Dementia, again, like I said, these dementia are classified according to the pathology. So, in general, what happens in dementia disorders are that certain kinds of proteins accumulate inside the brain cells. And these proteins are deleterious to the cells. And the brain cells are not able to clear this off. And this results in death or damage of the cells, and this affects whatever functions those cells or group of cells were doing, which comes clinically out as dementia. So, the well-known dementia, Alzheimer's disease, this is due to accumulation of a particular type of protein called beta amyloids. So, they accumulate and they form something called neurofibrillary tangles, and these are deleterious to the neurons. These neurons cannot do their normal metabolic functions. They usually start at a particular point of brain and extends to the other parts. Other kind of dementia is dementia with Lewy body disease. Again, a protein which accumulates inside the brain. This is called Lewy body. This again causes another type of dementia. Then tauopathies, frontotemporal dementia. Dementia can even happen due to stroke. There is a kind of stroke called microangiopathy kind of stroke, or stroke at a critical area of the brain, which can progress on to become vascular dementia. Certain other disorders like Parkinsonism can progress at a later stage to become a dementia disorder. This is called Parkinson dementia complex. So, dementia is not just one condition, there are different types of dementias.
So, doctor, how can we identify a person has dementia? What are the symptoms associated with this?
Definitely. Usually, the most common dementia is Alzheimer. This presents with a recent memory problem, though the patient may start forgetting recent things, what time it is, whether he had taken the medicine, whether he had eaten at a particular time. He may find it difficult to maintain valuable things like money, ornaments. They may lose it very easily. Sometimes they may have difficulty in speaking, so they may become altogether muted. This may be because of the fact that they are not able to find the exact words, exact names of the persons, so they may become muted. Routine changes may be there. They may find it difficult to do the daily routines that they were doing from before. Like they may find it difficult to brush, to handle TV remote, to make a cup of coffee. They may forget all these things. So, these are other cognitive abilities like planning, executive function. These may be also affected. So, they may not to do these things. So, any consistent change in the elderly that is affecting their daily activities, we should be suspicious.
Okay, now can you explain the causes of dementia? Does this condition run in families?
Rarely genetic disorders can present with dementia, especially ApoB4E allele mutation can present as Alzheimer dementia at an early age. Also, dementia with Lewy bodies can also run in families. Certain types of frontotemporal dementias also has got a genetic background. So, these kinds of dementia are genetic. Most of the other kinds of dementia are not genetic. They come without any particular reason. But there are certain researchers show that repeated head injuries, exposure to certain kinds of sedative medicines like diazepam, amitriptyline, use of opioid drugs, these are mainly used as painkillers, drug abuse like tetrahydrocannabinoid, that is ganja, or use of heroin, pethidine, these sort of drugs, this can later become turn into dementia. Lack of vitamins, especially vitamin B12, if chronically, it can also present as dementia. And certain infections like HIV, VDRL or syphilis, these can also present as dementia. It is very important to identify these dementias because vitamin B deficiency can be treated, HIV can be treated, syphilis can be treated. So, these are treatable causes of dementias.
Now, doctor, can you explain about the diagnosis of dementia? What are the tests to be done?
Diagnosis of dementia is actually, initially there is a screening test. So, we usually on OPD basis what we do something called MMSE, Mini Mental Status Examination. This is a 30-point questionnaire which usually affects various cognitive abilities of the patient. Usually the cutoff is taken as 20 in a normally educated patients. The score vary depending upon the educational status of the patient because depending upon the educational status the performance may vary. So, the usual cutoff is 20. Anything below 20 warrants further evaluation. Further evaluation is not possible in a busy OPD. So, we do consult with our neuropsychology colleagues. So, they will separately test for each cognitive area with different types of test, and then we can have a definite idea of which all parts of the cognition are affected, based on which we make a clinical diagnosis. From the clinical diagnosis, then we move on to the clinical testing phase.
Now, if a person is diagnosed with dementia, what are the treatment options?
Before the treatment options, we need to confirm the diagnosis. So, the most important thing is that to rule out all the treatable causes of dementia like HIV, VDRL, vitamin B12 deficiency, thyroid disorders, metabolic causes. So, we need to do the blood workup of that. Second thing is a neuroimaging. The preferred method is an MRI scan of the brain. So, usually MRI scan will show definite shrinking of size of certain parts of the brain. In Alzheimer, we see the entorhinal cortex is shrinking. In dementia with Lewy bodies, temporal and parietal lobe may be affected more. In frontotemporal dementia, the frontal and the temporal part of the brain may be shrinking more. So, this kind of gives us an idea about or gives us a correlation with our clinical diagnosis and the MRI picture. And there are advanced methods like PET, positron emission tomography, in which this actually measures the metabolic activity of the brain. So, those areas which are affected will be having less metabolism. So, we already know that these particular areas are affected in particular dementias. So, if the metabolism is less in that area, this is again confirmatory. And in Alzheimer's, again there are tests, newer tests that we do from the fluid that we take from the spine. This is called the LPCSF study. So, we test for tau protein and beta amyloids, based on which we can even plan treatment. So, this is the diagnosis part. One thing that you need to know about dementia is that still now there is no cure. So whatever treatment we are giving to the patient, this is to improve the quality of life and to delay the progression of the dementia, and that person should have a productive life in the community. So generally there are two types of medicines that we initially start. One is the cholinergics, rivastigmine, galantamine, donepezil. So these medicines act through the cholinergic system and improve the function of the memory. Again, these are not cures, this will just delay the progression. Another one is that NMDA antagonist. This is memantine. This is another group of drug that is also used to delay the progression of the memory loss or the cognitive loss in dementia. These are the general two types of drugs that we start initially. Then again, there are newer types of medicines that are under research trial. One was recently introduced and was withdrawn due to certain problems. So what they does is that they completely prevent the progression of the disease. So this is called monoclonal antibodies. There are a couple of monoclonal antibodies in the anvil for the dementia disorders. What they do is that they prevent the accumulation of the above said proteins inside the cells, and these are recent cutting edge technology. Hopefully in the next 5 years for persons with dementia it's going to be good. But the problem is these medicines are useful if dementia is detected only at an early stage. If you already have a dementia, late stage dementia, most of your cognition are affected, this is not going to reverse it. It's only going to stop the progression. Then dementia disorders can have associated psychiatric effects. They can have psychiatric problem, they can have agitation, anger, because a fully grown up person who does not understand time, what is the time? So he don't know at what time to sleep, what time to eat. This will cause agitation, irritation, anxiety. They may have alteration in their sleep cycle. So they may wake up at night time and sleep in the day. They may have something called wandering tendency because they don't know where they are. So they just wander away trying to find a familiar place. So I had a patient who traveled half a way across Kerala because of this wandering. So these are psychiatric conditions that may need psychiatric medicines. So don't be ashamed of giving psychiatric medicines. These are necessary for controlling these symptoms. So in general, these are the treatment options now available for dementia.
Another common query from our viewers is this condition preventable? What is your suggestion?
It's definitely preventable if you don't have a genetic tendency. Having a healthy lifestyle, reducing head injury, especially if you are into that sort of profession, if you are a professional footballer, professional boxer, or any situation in which there is a chance of head injury, preventing head injury is very important. Then having good exercise, sharpening your cognitive skills like reading, playing mathematical games, chess. If you know multiple languages, speaking in them, reading books in multiple languages have been shown to delay or even prevent dementia disorders. So these are the general things that you can do as a person. Then of course, stoppage of smoking, moderation of alcohol, and not using drugs.
Okay, doctor. Now, what do you have to say about Al Hilal Healthcare? Our viewers would like to know more about Al Hilal Healthcare.
Definitely. We have all the facilities to diagnose. We have an MMSE questionnaire. So any patient coming with dementia disorder, we'll be doing the MMSE questionnaire. And if he is qualifying into the dementia category, we will assess for a psychological evaluation. This is followed by MRI. We have the state-of-the-art 1.5 Tesla MRI there, and all the blood workups can be done from there, and the medications can be started. But then again, dementia is it's a difficult process, because in dementia disorders there is something called caregiver burnout. Those who take care of the patient are prone to develop depression and anxiety disorder. So we have facility for counseling. So yes, we have all the basic facilities.
Thank you, doctor. It was a wonderful episode with a lot of valuable information. and I hope the viewers would be benefited from this.
Definitely.
Thank
So
you.
Thank you for having me in this show. Thank you.
Thank you once again. So viewers, I hope this was a very informative episode and you got all the needed information about dementia. So till we meet again next Tuesday at 8 p.m. in yet another episode of BMC Global Live, Al Hilal Health World, this is Jaseela Mujeeb signing off. Good night.